Good afternoon, I'm Rodarin Pidlawan from BSE 3 Block 1. Our topic for today is all about the standard precaution and transmission-based precaution. Standard precautions are the work practices required to achieve a basic level of infection prevention and control. It's aimed to minimize and, where possible, eliminate the risk of the transmission of infection, particularly those caused by blood-borne viruses. And hand hygiene refers to the both washing with a plain or antibacterial soap and water and to the use of alcohol gel to decontaminate hands. With hands are not invisible, salt alcohol gel is the preferred method of hand hygiene with providing health care to the client. Hand hygiene shall be performed before and after contact with the client, immediately after touching blood, body fluids, non-intact skin, mucous membrane, or contaminated items, even with the gloves or worn during contact. Immediately after removing gloves when moving from contaminated body sites to client body site during client care, after touching objects and medical equipment, and the immediate client care visit before eating, after using the restroom, and after coughing or sneezing into a tissue as a part of respiratory hygiene. Next is PPE or personal protection equipment. PPE includes items such as gloves, gown, mask, respirators, and eyewear used to create barrier that protect skin, clothing, mucous membranes, and the respiratory tract from infections agents. PPE is used as the last resort in the work practice and engineering controls alone that cannot eliminate worker exposure. The items selected to use depend on the types of interactions a public health worker will have with the client that like modes of disease transmission. Wear gloves with touching blood, body fluid, non-intact skin, mucous membranes, uncontaminated items. Gloves must always be worn during activities involving muscular access, such as performing phlebotomies. Wear surgical masks and goggles or face shield if there is reasonable chance that a splash or spray of blood or body fluid may occur to the eye, mouth, or nose. Wear a gown if skin is clothing is likely to be exposed to blood or body fluid. Remove PPE immediately after use and wash hands. It is important to remove PPE in the proper order to prevent contaminated skin or clothing. Next is needle stick safety and prevention are implemented to prevent healthcare worker exposure to blood-borne pathogens. The Needle Safety and Prevention Act mandates the use of sharp with engineered safety device when suitable devices exist. The safety devices on needles and other sharps should be activated immediately after use. Used needles should be discarded immediately after use and not recovered, bent, cut, removed from the spring or a tube holder or other manipulated. And cleaning disinfections, client care areas, common waiting areas, and other areas where client may have potential contaminated surfaces or objects are that are frequently touched by staff and clients. Example, the doorknob, sink, toilet, and other surfaces and items in close proximity to the clients should be cleaned routinely with EPA registered disinfectants following the manufacturer's instruction for amount, dilution, and contact items. Housekeeping surfaces such as floor and wall do not need to be disinfected unless visible soiled with blood or body fluid. They may be routinely cleaned with a detergent or only a detergent disinfectant product. Next, we have respiratory hygienes. Client in waiting room or other common areas can spread infection to others in the same area or to local public health agency staff. Measures to avoid spread of respiratory secretion should be promoted to help prevent respiratory disease transmission. Elements of respiratory hygiene and coach etiquette includes covering the nose, mouth with a tissue with coughing or sneezing, or using the crock or to the elbow to the coin respiratory droplets. Using tissues to contain respiratory secretion and discarding in the nearest waste receptacle after use. Next, we have waste disposal. The Wisconsin's Department of Natural Resources or DNR regulates the management of medical waste under Chapter NR 526 Link in External of the Wisconsin Administrative Codes. Anyone handling, storing, or disposing of medical waste is covered under this chapter. Home generation of medical waste or except for rules related to the safe disposal of sharp. Next, we have safety infection practices and transmission-based precautions. Transmission-based precautions are the second tier of basic infection control and are now used in addition to standard precaution for patients who may be infected or colonized with a certain infectious agents. For the wind additional precautions are needed to prevent infection transmission. And contact precaution. Ensure appropriate patient placement in single patient space or room of available acute care hospital in long-term and other residential settings. Mixed room placement decision balancing rest to another patient. Its ambulatory settings place patient required contact precaution in an example room your cubicle as soon possible, and use personal protection equipment or PPE appropriately, including gloves and gown. Wear a gown and gloves for all interaction that may involve contact with the patient or the patient environment, and limit transfer and movement of patient outside of the room and medically necessary purposes when transport or movement is necessary. Cover or contain the infected of colonized areas the patient body, and use disposable or dedicated patient care equipment or blood pressure cuff. If common use of equipment for multiple patients of an unavailable clean and disinfected such equipment before use on another patient, and prioritize cleaning and disinfected of the rooms of patient on the contact precaution, ensuring room or frequency. Clean the infectants, focusing on frequently touched surfaces and equipment in the immediate vicinity of the patient. Next is trumpet precaution. Ensure appropriate patient placement in a single room of if possible. Is acute or care hospital with single room are not available. Utilize the recommendation for alternative patient placement considerations in the guideline for isolation precaution. In long-term care and other essential settings, make decisions regarding patient placements on a case-by-case basis, considering infection risk to another patient in the room and available alternative. In ambulatory settings, place patients who require droplet precaution in an exam room or cubicle as soon as possible. Instruct patient to follow respiratory hygiene, coaching, etiquette, and recommendation. And airborne. Ensure appropriate patient placement in the airborne infection isolation from ER or contracted according to the guideline for isolation precaution. It's setting where airborne precaution cannot be implemented due to limited engineering resources, masking the patient and placing the patient in a private room with the door closed will reduce the likelihood the airborne transmission until the patient either transferred to the facility with the EIRR or returned home, or restrict suspectable healthcare personnel from entering the room of patient known as suspected home to have measles, chickenpox, disseminated zoster, or smallpox if other immune healthcare personnel are available. Use personal protection equipment or PPE appropriately, including a fit-face NIOSH approved 995 or higher level respirator for a healthcare personnel. Limit transfer and movement patients outside of the room to medically necessary purposes. It transferred or movement outside an EIR necessary. Instruct patients to wear a surgical mask if possible and observe respiratory hygiene, coach, and diet. And immune susceptible person as soon as possible following a protected contact with the vaccine prevented infections. And that's all for today. Thank you.